if she would like to record. Um, schedules change, and we want to make sure that anyone that registered that found that their schedule did change for today, that they can have access to the information we share in this meeting. I'll give Amanda just a minute to make that arrangement. But I can say thank you, thank you. We're really happy to have you here this morning and to have such a diverse group of people. It's really exciting. Joining us today, as Jennifer mentioned, are some great resources for people that can provide additional technical assistance and tools, connect us all to tools that we can use in our work sites, in our communities, and in our homes to have healthy behaviors and healthier outcomes. Quality of life. That's really about quality of life, I think. So Stacy Stanifer will be joining us in a bit, and once she comes online, I'll give more of an introduction for her. But as Jennifer mentioned, she is a member of the UK Breathe team, as well as having a significant interest and background in doing investigation for informing health policy, particularly with environmental issues such as radon. So she'll be joining us in a bit. Traci Kennedy, wave Traci. Traci is with the Americans for Non-Smokers' Rights, and she has been working in smoke-free air initiatives since her launch of her career from her first city council meeting as a high school student. So even before she started her career. But in her current role at Midwest States as a strategist for ANRF, she works in a 13 state territory at the local and statewide level, and clearly on a national level as well. She's joining us here today. And I will give Traci the opportunity as well to add pieces to this to give more context and background to what she does. But her career started at the University of Missouri at the Department of Student Life, and she's worked in health information technology and building the state's electronic medical exchange network. Kennedy is passionate about the power of coalition building and grassroots policy change to impact population health. So you're in good company here today, Traci. I think you've got a good group who feels along similar lines. And then also joining us from ANRF is Onjewel Smith. She has worked in the nonprofit sector for a couple of decades, it seems, and she helps communities and organizations increase their capacity for change. And that's a tremendous skill set to have. She's conducted sessions on grassroots advocacy, coalition building, strategic planning. And throughout her career, she has helped develop alliances between local coalitions, community-based organizations, institutions, stakeholders. So she has a lot of experience in helping communities feel empowered and finding their strengths and resources and putting that together and making good things happen. So welcome to Traci and Onjewel. So they will be presenting in just a moment. I want to give us an opportunity to engage all of you from the get-go. So you've been putting your name and how you are working in this space. I love it because that's Jennifer's tagline, and it's just so good. I borrow it. But also we want to ask you a few questions to kind of help set the stage too. So Amanda, would you care to launch our first poll? We want to know where you are. What is your work status? And in the aftermath of the pandemic, we have found that many of us, our work situations changed. So we'd just like to have an insight from you on what it looks like for you now.
And as they scroll down, Mindy, the second question on there as well. Yeah.
Yes, ma'am. In relation to today's webinar, clearly we need to know what is most important to you so that we can provide resources and information that are going to be more fine-tuned to your work sites or your workplace's needs. So please feel free to select which one is your biggest concern. And Amanda, when you feel that we have a good representation there, if you'll share those, we'll.
Yeah, if anyone wants to submit their final answers, and I'll end the poll.
Interesting. It appears that we're pretty well mixed on our concerns, but with tobacco use standing out as being the biggest concern that most people have, and closely followed by electronic cigarette aerosols and lung cancer. And of course, all of this is tied together with lung health and lung cancer. So thank you so much, Amanda, doing that. So I think this is a good segue then to turn it over to Traci and Onjewel, and they can step us through the resources that they've put together to share with us today.
Well, fantastic. Thank you so much. It's great to be spending a portion of the morning with you. We're going to cover a good amount of ground in a short amount of time. So please do know that this is an introduction to the many resources, tools, and technical assistance that we can provide at Americans for Non-Smokers' Rights. So since our founding more than 45 years ago, our sole intent has been to eliminate the burden of smoking and secondhand smoke, and to really focus on everyone having the right to breathe smoke-free air, no matter where you work or what zip code you live in. And that really remains who we are in our mission to this point. So that's all we do all day, every day, is working on secondhand smoke. Now, what secondhand smoke means exactly has evolved over time, and we're going to talk about that. But we really see the problem at hand today, that people remain exposed to secondhand smoke in their workplace and at home. And that presents a very serious health risk to them and those around them. And what we see as the solution is smoke-free policy change that encompasses all products and all places, and is really a part of a broader element of a generally healthy community. So what's so important and essential about this issue is that smoking and secondhand smoke remains a leading cause of preventable death and disease. So of course, as public health advocates and as people living in our communities, we see a lot of issues that are pressing and important, but it's at our core, this is still one of the most significant public health hazards, and it's immediate, especially for those with other risk factors like heart disease, high blood pressure, or asthma. And I'm not talking about decades of secondhand smoke exposure. I'm talking about immediately, within 20 minutes, within an hour, within a shift. So that's what is so concerning about secondhand smoke. And what exactly is it that makes secondhand smoke so harmful? It's the same thing that makes e-cigarette aerosol, or the byproduct of when someone, inhales on an e-cigarette and then releases aerosol. It's the size of the particulate matter. So particulate matter is just a fancy word for the little particles that make up secondhand smoke, including e-cigarette aerosol or marijuana secondhand smoke. And because they are so tiny, that's what makes them so dangerous. They can be breathed in very deeply into the lungs. And that's what makes it so hazardous, especially with those with other chronic conditions. This is especially top of mind. We were talking just before the call started. Some of you are waking up to really hazy skies due to wildfires. We're all talking about air quality and how it might not be safe for some groups to go outside and to exercise, or some should even wear a mask outside. And we're ignoring the fact that many people face that same level of unhealthy air quality at work every single day or in their home. So that same scale of what's hazardous outdoors is hazardous indoors as well with secondhand smoke. So that is a very significant problem. I want to reiterate that e-cigarette aerosol is not just water vapor. It's not that simple. We've known for more than 50 years the research that shows that secondhand smoke is harmful. So we've known for a long time. We have decades of research. But now we can say very firmly that we know that some of those same chemicals, the things that make it so bad, heavy metals, cancer-causing chemicals, or carcinogens, those are also found in e-cigarette compounds. So that is what concerns us. And we want to be sure that when we're talking about a smoke-free home or a smoke-free environment, that also includes use of electronic smoking devices. In addition to being concerned about e-cigarette aerosol exposure, I mentioned marijuana secondhand smoke. There is a movement happening nationwide to expand adult use of cannabis, and that means exposing more people to secondhand smoke in their home and at the workplace. So I bring this up because it's one of the number one things we get calls about at Americans for Non-Smokers' Rights, and the concern persists, whether you're a musician performing in a workplace or whether you live in an apartment building and share a wall with a neighbor. If someone is smoking marijuana or vaping cannabis indoors, that presents a similar risk to cigarette smoking. So cigarette smoking, vaping, marijuana, hookah, cigars, all of these present the same health risk. The good news is we have made significant progress. All of these triangles and circles represent local smoke-free laws and ordinances that ensure that 100% of workplaces are smoke-free. The blue states are states that have determined all workplaces should be smoke-free. So I didn't want to say, this is so terrible to breathe in secondhand smoke without something we can do about it, because we know the number way to eliminate the risk of secondhand smoke exposure is to make an indoor workplace or home 100% smoke-free. With all of this progress, we've learned a lot. We know that smoking sections, just saying you can smoke in this area, but not in this area, that just doesn't work to eliminate the risk. We know that there's no ventilation system on the market that can effectively remove those hazards of secondhand smoke. They can push the air around. They might even make it smell a little better, but because those particles are so small, the ventilation systems just can't address that. The other thing we really want to emphasize is taking action at the local level, because secondhand smoke doesn't impact everyone the same way. And Kentucky residents are more exposed to secondhand smoke, are smoking and vaping at higher rates than the rest of the country. But that doesn't mean we don't deserve the same smoke-free protection. So, not only is it costing our health and a risk to our lives, it's also a significant healthcare cost, taxpayer costs. So that's a little bit of background on the science, and I'm going to kick it over to Onjewel to talk about engaging employees in the movement to pass policies.
Thanks, Tracy. Hi, everyone. So much of this movement comes from the voices of people who have been exposed to secondhand smoke, whether it's in their workplace or in their homes. When people are fed up with the exposure and they see the impact it's having on their health, they want to do something about it. And so this is an example of some casino workers in New Jersey who have been speaking up after years of still being the only employment sector in New Jersey that's being exposed to secondhand smoke. And they are seeing the impact it's having personally on their lives and their fellow employees, and the folks who love their job but hate the smoke and are being impacted by that. So these are some of the stories and the examples of people sharing their story and trying to do something about those environments. So when we talk about smoke-free communities, we have to ask the question, like, who needs smoke-free environments the most in your community? And ask the question, are we doing right by our communities? And when we think about those environments that still allow smoking, we're talking about the folks who are actually being overexposed. They're getting more secondhand smoke exposure than probably a smoker themselves would get sitting in their own smoke. Like they're working shifts, they're working long hours, and they're being just compounded by secondhand smoke. And we're talking about blue collar, hospitality workers. We're talking about residents and multi-unit housing, folks who are being exposed in their homes. And again, they're being overexposed and underprotected in these situations. Next, please. Again, these are the folks who are having the biggest impact. That smoke is lingering in the air and in the materials, and it's seeping through walls, the outlets and under doors. And they have the fewest resources to do something about it. They're probably low-wage earners or don't have health insurance. They're not able to get medical help. And if they do get it, they're coming out of pocket and paying for those. Many are being forced to miss work, lose their shift, and even have to lose or change jobs. And residents in housing, particularly multi-unit housing, sometimes are forced to vacate and find another place to live. And those are situations that no one should be put into. Everyone has a right to breathe healthy indoor air. And these situations around secondhand smoke exposure really double down on social determinants of health. When we really want to talk about people living healthy lifestyles, those smoke-free environments need to be part of the conversation. So we have some tools and resources to share with you. And as Traci mentioned earlier, this is sort of just a snapshot of what's available. And I believe you guys will have access to some of these resources and a ton more. We'll share some of those links and documents that you guys, I think, will be shared with you guys later. But we really encourage not only to provide your employees with, of course, smoke-free workplaces and those smoke-free indoor air environments, but to encourage smoke-free environments outside of the workplace. And so here's a number of tools and resources that will help with that. So first, I'm visual and probably a lot of folks are, but being able to share some easy to understand infographics. And while these documents they're colorful, of course, they get your attention. They do look kind of busy, but they tell a story, and that story is easy to follow. You can pick any place on these infographics and get some really good, valuable nuggets of information. But they tell the story about exposure to secondhand smoke, the dangers of secondhand smoke exposure, and the benefits of smoke-free environments, and really help to drive the message home. And the good thing is, a lot of this information's there. You don't have to dig it up and find the information. And if you decide you want to create your own from information that exists, you can certainly do that. Ads in social media, there are a ton of examples of ways to help deliver the message. The one on the left, I think, hits close to home because it tells the story. It's you can't wash the smoke out of your kids' clothes. I mean, you can wash the smoke out of your kids' clothes, but not their lungs. And really encouraging individuals to think about the impact that their personal smoking or the smoke that's coming into their residential areas from outside of their apartment or unit, that's having a lasting impression on the health of them and their families. And so the one on the right just shows how someone else is smoking in another unit still makes its way in a number of ways to others in those units. Other examples, a lot of places are using just other things that happen throughout the year to make an opportunity to connect the issue to secondhand smoke exposure and smoke-free environments. So for example, February is Heart Month, and finding ways to connect secondhand smoke exposure or smoke-free places to heart health. June, right now we're in Healthy Homes Month. And so there's opportunities to talk about healthy smoke-free homes and how you can protect your loved ones by, one, being smoke-free yourself, but two, making sure that your environment is smoke-free as well. More examples of delivering the message, how secondhand smoke can infiltrate throughout buildings, and then also sharing the message that e-cigarettes, we hear a lot of from folks who say, well, it's just water vapor, I'm just vaping, or I step outside to smoke. And all of that still makes its way into the hearts and lungs of the people around them. And so it's really important to help communicate that these are still toxic environments. These products still are delivering the same toxic secondhand smoke and aerosol, and that we are encouraging healthy smoke-free indoor air environments. One of the resources we have for folks who are in those situations, so just like employees are speaking up and asking for smoke-free work environments, residents in multi-unit housing want to do the same. And we have a great tool called the Smoker Next Door, and there's an example of it on the left. We'll be sure to share a link to that for our website. But it's tools for the resident to be able to work to encourage their property to go smoke-free, and how they can go about that process, because they want to feel empowered as well. And then there's this incredible video talking about secondhand smoke and housing and smoke-free homes and the impact secondhand smoke has. I don't know if we have a moment to play that, or if it will play, but we will also share the link for that as well. Okay. So maybe that won't play, but we'll be sure to share the link for that.
Do you want to try to play it?
Do we have time to play that if you guys are able to
I
pull
think
that up?
so. Yeah.
Okay, because yes, this next slide is the last slide other than context. So that would be great if you can.
Is the link embedded in here, Onjewel?
Yes and no.
Okay.
Yeah,
For some
maybe
reason
not.
it's
If
not
you're clicking
coming
it.
up for me.
Okay.
Sorry.
Yeah, sorry guys. It's a great video, trust us.
We'll send that to everyone after, promise.
Maybe we can drop it in the chat before we're done with this session. But I think the next slide is just talking about some of the things that are very important to, sort of the fundamental pieces of this effort. Smoke-free is good for health and it's good for business. And we believe that everyone has the right to breathe smoke-free air. As Traci mentioned, there's no safe level of exposure to secondhand smoke. And every employee, resident, and visitor should be protected from exposure to secondhand smoke. And my goodness, no one should have to choose between his or her health and a paycheck or a place to live. So we've got a ton more information to share with you guys. And if you guys are interested in learning more, here's our contact information. We'd be more than happy to share additional tools and resources with you. So thank you for the opportunity to share.
Wow, thank you so much, Onjewel and Traci. It's just such vast information and resources available to help folks. Do we have any questions for Traci and Onjewel?
Mindy, I'll start off with a question. Thank you, Traci and Onjewel, for that valuable information and also for sharing those great resources. But the question that I have is, what is the first step a workplace should begin if they want to address their tobacco or their on-site environmental policy?
Yeah, I would always say step one is engaging the people who work there, understanding what the experience of employees is, either through just like maybe like a sack lunch conversation or some sort of survey, just asking people where they are, where they're exposed, how they might be impacted by this, because we find by and large smoke-free policies are popular, easy to enforce when people have an engaged process, when their ability to really take part in what makes their workplace smoke-free, and to understand the why behind it. Even people who then choose to smoke themselves can understand how complying with the policy helps protect their coworkers, and are happy to support that.
Thank you. I want to invite everybody to unmute yourself if you have a question, or if you prefer, type it in the chat. But for now, another question. Sure,
Angie,
go
I have
ahead.
a question. Yeah. So, you provided some great information and tools on kind of the dangers of secondhand smoke and even e-cigarettes. And how do you have some tips on how you can communicate that in a way that would be, how is it that you don't offend the person in asking, like kind of in that protecting the environment and those kind of things? So I think about, even my father-in-law who was smoking and now is vaping and is like, it's fine, right? And when my daughter was like real young, everything was cool. And it's like, okay, I'll do everything outside. But now that she's getting older, and I'm like, it's still a fine particulate matter. So any tips on engaging in those conversations for those people who absolutely love your children and your family and you love them and their workplaces, but how do you do that without kind of creating a defensiveness, if you will?
Yeah, one of the things we say is, it's not about the smoker, it's about the smoke. And really taking that focus away from it's not about the person, it's more about the impact of what they're doing and that it's having. And we really try to just start with sort of common ground. And if it's the health of the people you love, if it's the impact, and if there's a way to demonstrate or talk about sort of how it's affecting folks, start with that, because that's where the common ground is. And then sort of cycling back to, well, maybe the trigger is X, Y, and Z. And so that it's not really that this person, because it's not a judgment on a person's, personal lifestyle or addictions or habits. It's more about the impact that is having, and starting a conversation there. And, just like we would deal with anything else, having some understanding and compassion about it. And hopefully they have the same about the people that are being impacted by what's happening.
Thank you. Looks like Elle has a question. We cannot yet hear you, Elle. We see some great hand movement though.
Well, and it's so dark in my office. That's why wasn't. So I'm just a dark shadow, and I apologize.
We see your hands though. The hands are good. Jazz hands.
But I don't like talking without a face. I don't know, something like that. So I apologize. But my question is kind of generically to everyone. So I do wellness screenings for the community as well as the employees. We used to do a pulmonary function test as part of one of my screenings, but since COVID, we stopped doing that as an option to help people with respiratory, engagement and something like that. But I'd like to continue to do something along the lines of still lung and health. I don't know what other avenue I can do other than literature, handing out literature. If you have suggestions, I would really appreciate it. I would tie them into something else, like if I'm doing blood pressure or if I'm doing a heart check of some kind. I want to kind of throw that also in the mix on those screenings, even if I can't do a specific screening for something related to people who have either asthma or difficulty breathing, bronchitis, all the things that come from secondhand smoke, but like tie that awareness. I know someone had mentioned, I don't know if it was Traci or Onjewel that said, February, kind of doing something maybe in February. So I like to use observances as an opportunity to really push that, I guess. So I just thought if I can throw that out there to this group, anything would be appreciated. If you can say, you would be great to use this next time you go out and you're covering something on heart health, add this, secondhand smoke information, or if there's other more engaging things than handing out a flyer, I guess that's, sorry, it's a roundabout way for that one,
No,
but I
it's
love
great
the flyers. I'm a
questions,
visual
though.
person too, Onjewel, so I'm on board with that as well.
So my first question to you, where are you located?
I am in Murray. I'm at Murray Callaway County Hospital. I'm fairly new to the wellness works coordination. So most of my clientele is our employees, about over 1,000 employees, but I am also a community outreach as well. So we do the community centers, we do senior homes, several corporate businesses, and I have a list of free screenings. And like I said, the pulmonary function test used to be part of my free screenings, but since COVID, we haven't brought that back. But doesn't mean I don't want to kind of push something that has to do with lung health in my screenings.
Well, that's that's fantastic for you to be connected in the ways you are, but also to have the resource of a regional cancer control specialist in your district that will help you plan.
Yeah, and
those
Angie and I are
activities.
starting to get to know each other.
Yeah, so that's what we're about at KCP, is to provide that local community technical assistance, because things can be customized and tailored based on the needs and the culture of where we live and work. And that's really important. So Angie, do you have any tips? Angie Timmons.
Well, Elle is fairly new to her position, so we've met the last few months, and so we've been starting to work together. So we've been talking, so I can get with her. You know, we can meet soon. We just talked this week, I think, on the phone. So we can come up with some ideas that would be best for the people that she sees at the hospital and the community.
And other tools. That she asked such a good question. Traci or Onjewel, are there things that you see, or Amanda? I know like a lot of folks in that space that have been kind of catching people's attention in conversation.
I'm going to jump in here real quick.
Yes, or Tanya, go. Yeah.
Tool that I absolutely love and I've used for years, but it's the smokerlizer. I don't know how many folks have used that. But you're measuring expelled breath and you're able to show them kind of and a lot of times if somebody's exposed to a lot of secondhand smoke, they're going to score kind of high on that. And I think that's always shocking to people. But it is kind of on that same kind of wavelength of what you were doing previously. So I'm not sure if you're comfortable doing it yet. But we do that at different things, especially if we're focusing on lung health at a program. They're really, really good eye openers for folks. And they usually if they come back to the annual event the next year, we have an event we do in Harrison County, and they always want to know if they've improved. So that's good. It's a good example of folks really, once they're aware, they can take some steps to hopefully have better lung health. But yeah, there's plenty of devices out there. That's just the one that we use, but they're really good educational devices.
I think that's a great example. And I'll just add to that. I was at a recent, my annual physical with my primary care provider. And, you know, they always ask, do you smoke? Well, this time she asked, are you exposed to secondhand smoke? And I was surprised by that, because that was the first time a medical professional asked me if I was exposed to secondhand smoke. Because, you know, of course, it was like, nope, I don't smoke. Nope, nope, nope. But then it made you think about, am I exposed? Is it at work? Is it out where I, you know, hang out? You know, is it other family members? And so I think in combination with that tool you just mentioned too, right? Like bringing folks awareness of their personal lung health as it relates to exposure to secondhand smoke.
Just one really easy thing too is providing some sort of outlet for people to share their experience. A guide, storage, just a way for someone to write on a postcard, like, this is how this is impacting my life. My teenager came home with a vape and I don't know what to do about it. I don't know what's in it. Or my parents smoked when I was growing up and now I have asthma, and just kind of collecting those pieces. We've done it so many ways, like on a postcard or jotting it down. And it sounds really simple, but it's a really important first step to acknowledging what people's lived experiences. And so we're not talking at people about what exposure is like. They're telling us what it's like for them. And not everybody has a story, and that's fine, but it's free and it's easy to let people know you're there to hear them and what it's like for them.
Great advice, Traci. That shared experience and the things that bind us together. And it's empowering to know you're not by yourself. And to hear the stories of success too, gives us all hope. So thank you both so much. I would encourage you all to continue to put questions related to what we discussed so far into the chat, because we will make sure, even if we run out of time today, we will answer those questions in follow-up correspondence. So please ask whatever comes to mind. But I think right now we'll transition over to our next presentation, and that is Dr. Stacy Stanifer. She is with UK Brief. Bear with me, I'm going to open that window back up. Okay, So Stacy has been a tremendous resource for Kentucky, and especially in Eastern Kentucky. She is a member of the Cancer Prevention and Control Research Program and Lung Cancer Translational Research Group at Markey Cancer Center at the University of Kentucky. And how I first became familiar with Stacy is through UK CARES, which is the Center for Appalachian Research and Environmental Sciences Community Engagement Corps. And specifically, that was after the terrible flooding events that happened in Eastern Kentucky last summer. And there were a lot of environmental concerns that came up after that, not just for the residents, but for the first responders that were coming in to help with cleanup and rescue. And so I will turn this over to Stacy. She can expand on her background to provide context as she wishes. And thanks for coming today, Stacy. Welcome.
Thank you for having me. I've enjoyed the conversation so far and taking notes myself. So thank you. So today, as I go through, let's see, there we go, these advancing for you. I'm going to talk about some projects today. One being supported by the National Institute of Environmental Health Sciences, and then another with the Kentucky Department for Public Health Radon Program. So I just need to disclose that with you all. We've been talking a lot about secondhand smoke and tobacco use. Today, I'm going to share with you some information about radon. So the link between some of these common indoor air pollutants and health effects are well established, but today I'm going to share with you information about radon and how and what action steps that we can take to encourage healthy indoor air at the workplace and in the home environment, and share some resources with you. So just to kind of begin, I'd love to give you just kind of a Kentucky at a glance. We know lung cancer is a serious and prevalent environmentally induced disease. And in Kentucky, we have a lung cancer problem. For many years, we've led the nation in both incidence and mortality from lung cancer. Much of that does have to do with the prevalence of smoking. So we still have quite a bit, almost a quarter of our adults population that continue to smoke, and many of the communities across Kentucky lack smoke-free ordinances. In addition to tobacco smoke, we also have a great deal of our population that is potentially exposed to high levels of radon. So the EPA, according to them, about 93% of our Kentucky counties have moderate to high radon risk potential. And a recent analysis found that only 13 out of every 10,000 homes in Kentucky have been tested for radon. In that same analysis, counties with a high prevalence of smoking have lower rates of home radon testing. And why is that concerning? This lack of home radon testing among a high smoking prevalence population is particularly concerning because the two of these, so the tobacco and the radon smoke, they work synergistically on the development of lung cancer. Now, what does that mean? Well, separately, exposure to secondhand smoke and radon is a risk factor for developing lung cancer, but there is no safe level of exposure to either tobacco or radon. However, co-exposure to these two, so co-exposure when you're exposed to both tobacco and radon, it increases the risk of developing lung cancer nearly tenfold. So when we take into consideration Kentucky's moderate to high radon risk potential, as well as our high smoking rates, these kind of create this perfect storm for the overrepresentation of lung cancer in our state. Now, many Kentuckians are unaware of what the dangers of radon are. A lot of folks maybe have heard about radon, but they really aren't all that familiar with it. And this is largely because the naturally occurring radioactive gas is both colorless, it's odorless, and it's tasteless. So you wouldn't know what your exposure to it is or know that you're even being exposed to it because it doesn't cause any immediate symptoms unless you tested your home for it. The radon that we breathe does come from the natural decay of uranium that's found in the Earth's crust, and it's going to be variable depending on how much uranium is in the soil that is, right there beneath your home. Radon is found in both indoor and outdoor air. However, levels indoors are typically higher than what's found outside because the gas enters and then begins to accumulate as it gets trapped inside homes. This can be any indoor space. So this could be our homes, our work sites, our schools, our places of worship. All of them have the potential to harbor dangerous levels of radon. And because the gas is colorless, odorless, and tasteless, you would never know what the level of radon that you're being exposed to is unless you test for it. So in the US, we measure radon in picocuries per liter of air. It's a measure of radioactive decay in the air. And the EPA would suggest that if someone's home tested at or above 4.0, they should take action to fix the level of radon within their home. So the health consequences of radon have been recognized for a long time. This quote that is from a former US Surgeon General comes way back from 2005. The science is clear that radon is the second leading cause of lung cancer in the US, and it is the leading cause of lung cancer among never smokers. So as he states, breathing radon over prolonged periods can present significant health risks to families. Recently, there was a study that was published that found children who were exposed to radon in the home had higher levels of certain inflammatory biomarkers in their blood. What was concerning about that is that that finding is that when those particular biomarkers remained elevated in children, we know that they can lead to health consequences like major depressive disorders, neurodegenerative diseases, asthma, and COPD. So while there's more research is needed, it was clear even back in 2005 that prolonged periods of exposure to radon can cause significant health risks to families. And as he points out, everyone needs to know about radon and have the information and the tools that they need to take action. And while we have a problem in Kentucky, exposure to tobacco and radon is preventable, and we have the opportunity to really make a tremendous impact on the health of our state by reducing exposure to both of those. So it's important to recognize that healthy indoor air is doable and it is a priority. Testing for radon and fixing a home when high levels are found can reduce the risk of lung cancer. Public health efforts have resulted in a gradual decline in tobacco use, yet there really has been very little to move the needle with regards to radon testing and mitigation. So encouraging everyone to test their home and know their level is important. Fixing a home for radon is called radon mitigation, and it can reduce radon levels inside the home by as much as 99%. In Kentucky, mitigation works. If you're going to have your home mitigated, it must be done by a certified radon professional, and you can use that link there to find someone close to you that could do the work. The cost of radon mitigation is variable, and it will depend on how your home is constructed. But it's important to know that homes can also be built, so at the time of construction, be built using radon resistant construction techniques. And in doing so, it is much cheaper to address radon during a build than after the fact. So it really, in comparison, it costs about $400 to $500 at the time that a home is being built. Because radon testing is necessary to determine exposure risk, I just want to take a few moments with you to review testing with you briefly so you have a good understanding and then can share this information with your employees. Testing a home for radon really is pretty simple. Various methods exist, but the most popular includes a short-term, long-term, or continuous monitoring. So in Kentucky, residents can request a free short-term test kit from local health departments or from the state radon program. You could also purchase these online from home improvement stores. So in the images that you see here, the short-term test kit is the one that's up in that top right-hand corner. These are the quickest way to test for radon, and they typically the short-term charcoal test kit, like the one that's displayed there, you would leave that out in your home for a period of about 3 to 7 days. And then you end up mailing that into a laboratory using a postage paid envelope that's included with your kit. And then you would get your analysis back. Usually within a week, you'll get your level back. Because radon levels tend to vary slightly from day to day and season to season, the short-term test kit results are less likely to represent year-round exposure within the home in comparison to this longer-term or continuous monitoring. So longer-term testing is anywhere from 90 to 365 days. Because of the longer deployment, they will be more representative of a year-round radon average in the home. The one there in the center that kind of looks like a hockey puck is an example of a long-term test kit. These are a little bit more expensive. They're about $40. And the biggest drawback is that if you need results quickly, say for example, in a real estate transaction, you'll need to use a short-term test kit. So these longer-term test kits, again, at least 3 months of being deployed within the home, but they do give a more representative exposure level for a year-round exposure level. Additionally, there are continuous radon monitoring devices like the one you see down there on the right. These are more costly, but the one you see here provides a daily and a long-term measurement. And the benefit of this particular device and other continuous monitors is that they are running all the time and you'll have those results right there. There's really no need to mail off and wait for an analysis, but they do tend to be a little bit more costly. This one is approximately about $140. And lastly, you can always hire a certified radon mitigation professional to do the testing for you using that same website. But again, that's a little bit more expensive. So where to test, deciding where to test is really important. You would advise your employees to test on the lowest livable floor, basement or living room, for example, where you or a family member would spend at least 8 hours per week. You keep the device away from anything that may affect the results, like a bathroom, because there's too much moisture, being in consistent sun or near windows. You want to keep the device about 2 feet off the floor and out of the way of disturbances like kids or pets, because once you've started testing, you don't want to move the device. You just leave it there and let it do its thing. And then keeping the device away, at least 5 feet away from doors, windows, or air vents. Now, I want to just draw your attention to the fact that it doesn't say only homes with basements should be tested for radon. So it's kind of a common misconception, and really all homes should be tested for radon. One of the projects that we have going on right now that seeks to increase home radon testing is called Radon on the Radar. So we're working with community partners, citizen scientists, and public libraries in the 4 counties that you see here to make home radon testing accessible and free. Because we've developed these radon test kits and we've placed them in the public libraries in those 4 counties. So patrons can borrow them as they would just like checking out a book. They can test their home, another level, and then return it back to the library for someone else to use. So here you can see where the project is taking place in Christian, Logan, Rowan, and Pulaski County, and they all have really a lot of variable radon potential within each of those counties. On the right, you see an image of the radon detector kit that contains all the things that one would need to test their home. And for this project, we provided 50 radon detector kits to each of the libraries and trained their staff on the dangers of radon, how to use the detectors. And we've been marketing these throughout the counties. And anyone with a library card is welcome to borrow a detector. For those of you with employees in these counties or in surrounding counties, this may be a wonderful option for you to encourage testing among your employees. And in case you're curious, the cost of these kits to put them together is about $150. So you've got the cost of the detector, this Amazon Basics case, and then we created some instructional cards and frequently asked questions and had them laminated, and they're included in there too. So the graph that you see here is from our pilot library loan program. So it's showing the number of radon test kit checkouts and pilot study enrollment over time in these 4 counties. And the encouraging news is that the program has proven itself to be feasible. And we've had 313 homes test for radon that had potentially never been tested before. So when folks go and they borrow these detectors, they're also able to enroll in our study. So that would involve them providing us with their radon values. And of the 87 library patrons who enrolled in the study, The overall average 2-week long-term radon level was 8.7 picocuries per liter. So remember back a few slides where I just told you that the EPA's action level was 4. So our average among these 87 folks in Kentucky was above that, so 8.7. And the values ranged anywhere from 0 to 133.4 picocuries per liter. 39% of the study participants had radon levels that were above the EPA action level. But we found this program to be a really valuable resource for community members. So the quotes that you see here are from our pilot library loan program study participants. So through this program, we've been able to address radon health concerns and minimize disparities in testing. And the quotes that you see here about offering this free service to library patrons resulted in greater access. And people are telling us, I would have never thought to test my home if the service had not been provided. And I appreciate this excellent resource from my local library. So in my mind, this could be something that work sites could offer too. And your employees may tell you these same things. So some of the worksite opportunities that involve radon and of course with secondhand smoke. So the importance of enacting smoke-free worksite policies, having tobacco cessation resources available for your employees, but then educating your employees on radon, encouraging home radon testing. If you have tested your own home for radon, share your personal experience with your employees and coworkers and just tell them how simple and easy it really is to test your home. You could develop and create your own radon test kit loan program. So offer radon test kits to employees on site. We know that having test kits available in primary care offices has prompted home radon testing with patients, and having them available for free at libraries was appreciated by patrons. So this might be something that work sites could do as well. In addition, we commonly hear the cost of mitigation is prohibitive. So people won't test because they know they can't afford mitigation. And one of the potential avenues for overcoming this is having mitigation as an allowable expense from a flexible spending account or a health savings account for your employees. So talking with insurance providers and seeing if that's something that they would be willing to do. In that case, you would get the healthcare provider to write a medical letter of necessity, and then they could, if the insurance would allow it, they could use money that they put into the FSA or HSA to cover the cost of mitigation. Just as a reminder, you can request free radon test kits from the Kentucky Radon program. So I've listed that website here. You can direct your employees to the website and they'll mail you one of those short-term test kits. And then you can also go to that website and there are a list of health departments that have a radon program. So it might be your health department in your area that you could request request a test kit from. If they don't, again, the state radon program is an option for you to request them. On our website, I just want to share with you a few resources that we have available that might be helpful for you in the work site. We do have, if you go to that website, there will be a list along the left side, but we have radon data by county. So these are infographics where we've looked at every county. This one in particular is Daviess County. And we show you kind of what the radon risk potential is. We also tell you how many homes out of 100 have tested. So very few, you'll find very few across the state have hardly any homes out of 100 that have tested. So we have these for every county as well as a statewide map if you want to take a look at that. We also have flyers on our website for those 4 library loan programs. So Christian, Logan, Pulaski, and Rowan, if you wanted to print off that flyer and share that with your employees and encourage them to go to the library and borrow a test kit. We also have some quick facts about radon and secondhand smoke. So you can see the 2 on the top about radon and one about radon, one about secondhand smoke. And then we have a newly developed one about radon in children. So this is encouraging healthcare providers and school officials to take action to protect children from the dangers of radon exposure. Because one of the things we know about radon, duration and concentration both have an effect on the potential risk of developing lung cancer later on in life. So we want to reduce the exposure to our children now. and in order to reduce the risk of developing lung cancer in the future.
So Stacy, I have a quick question here, and
Sure.
we're starting to run a little short on time, but so the radon risk is cumulative, correct?
Correct.
And it's exacerbated by what additional factors?
Tobacco smoke, number one. So duration and concentration are going to play into radon risk. So the longer somebody is exposed to radon, even at low levels, is going to increase their risk. Now, if they're exposed, for instance, the home tested 133.4, that might not take quite as long as somebody who's exposed to maybe 4 picocuries over time to develop lung cancer. But certainly when we have the co-exposure of tobacco and radon, that puts them, even if it's secondhand smoke and radon, puts them at a much greater risk than someone who's been a never smoker and not exposed to secondhand smoke. But we know never smokers can develop radon-induced lung cancer. And in Kentucky, that it's estimated approximately 1,033 radon-induced lung cancers occur annually. Most of those are going to be folks who are also exposed to tobacco, but certainly know folks who have never smoked or been exposed to secondhand smoke and developed lung cancer.
Wow.
I want to share one, especially I think it was Carrie perhaps that talked about the smoke yesterday. We're thinking about indoor air quality. I just want to share with you, in case you've never heard of these. These are DIY box fan filters called Corsi Rosenthal boxes. They cost about $65, but they help clean indoor air from viruses, wildfire smoke, pollen, and dust. And it's basically you buy those 4 filters from your local Home Depot or Lowe's, or and you have a 20-inch box fan, but you can follow the link on the bottom. These can be really helpful for indoor air if you're being affected by things like wildfire smoke. We've recommended these after the flooding last year for some of the emergency shelters to try to keep the air clean where folks were gathering after the flooding, but also when we've had wildfires in Eastern Kentucky, we had folks reach out to us about the air that was in some of the schools and in the homes too. So this is an inexpensive way to build a box fan filter and try to clean the air within your home. So I just wanted to make folks aware of this. If they weren't, this could be something that your employees could really benefit for, or maybe even build them in your worksite if it's being affected by wildfire smoke or things like that. That's all I've got.
Thank you,
That was helpful.
Stacy. Well, that's great information. I'm intrigued with the fan filter. That looks like a project, right?
Yeah. Yeah.
So no, that would be I don't know. I think about things like that. It's actually kind of fun, and it could be a family project. And it could be something that Worksites could help provide, the materials, so families could create something like that. Lots of resources and tools here to share. So I want to take advantage of just a little bit of 30 more seconds, 60 more seconds of everyone's time. First, if Amanda, I believe we had one more poll that we wanted to use today. Is that correct?
Yeah, we actually have 2 more polls.
Great. So if we could launch the first of those while you all are thinking of additional questions for Stacy or for Traci and Onjewel. And it could be related to the future topics. So what are some topics you would like to hear about in the future from anyone presenting today, or from KCP, or from the consortium, or from the Kentucky, from UK College of Public Health? It's a lot of resources at the table today, and we want to provide what you feel is going to be most useful to you. All right. Do we have the results of that poll? Fantastic. So we want to know more about aerosols and secondhand vape. Wow. Yeah, I'm interested in that too. and the transference of these environmental exposures, from place to place, from work site to home and from home to work site, and things that we can do to mitigate and reduce those exposures. And then the last poll, Amanda. And thank you all. There's just been so much good information. It's hard to get it all in sometimes. What are your needs? What can we help you with? There are different ways to conduct the activities. And it just depends on what you feel that the need is in your community at your work site. Take your time and submit that. Excellent. Thank you all so much. This is really helpful to us, particularly as we go about conducting our work plans and knowing how best to help you. This is very helpful information for us to do that and to customize those interventions for you and your teams. So we will follow up with communication after this event with a complete directory of all the resources we've listed here, as well as information on how to contact the presenters and the cancer control specialists from Kentucky Cancer Program. They are a tremendous resource for the community and for work sites to implement these activities that address the concerns that your communities and work sites have said. These are the things we want to tackle. These are the things we need to tackle. Is there any questions before we sign off today? Oh, thank you, Stacy. So that's great information, and expanding the library programs to all libraries that Stacy had just spoke to us about that project. That would be tremendous. And two, I wonder about replicating that kit at work sites that then employees could check those kits out from their work site. And so we would love to follow up with you and have additional details about that project and how we might advise others to replicate it. So thank you all so very much. Thank you to Stacy and Onjewel and to Traci for presenting. Thank you to everyone who helped make today happen. And I really appreciate your participation. We love having you, and reach out to us for follow-up. And have a wonderful, wonderful day. Take care.
Thanks, everybody.